Hi, I'm Ben Gonzalez, and this is TDI. Today we're talking about mental health and how insurance can play into that. A lot of health plans do have coverage for mental health and substance use disorders, but you really have to check the plan. So joining us to help understand this important topic is Cindy Wright from TDI's Consumer Protection section. Hi, Cindy.
Hi, Ben.
Well, thanks for helping us out today. Does insurance, for the most part, cover mental health treatment?
For the most part, it actually does. Not all health coverage is subject to Texas law. One example would be large employer health plans, for example, but generally speaking, the law requires equal coverage if mental health care benefits are offered.
That's a word we hear thrown around a lot, talking about mental health parity. Can you describe what that means?
Sure can. Parity describes the equal treatment of mental health conditions and substance use disorders when you compare it for coverage for ordinary medical problems. The idea is that health plans should cover mental health the same way they treat coverage of medical and surgical care. The coverage should be just as extensive and just as accessible, regardless of the type of condition. So, even things like financial requirements, deductibles, copays, and coinsurance for the mental health should be on par with requirements for medical care.
And if somebody finds that they or feels like they're not being treated the same by their insurer for something like that, what should they do at that point?
Well, we always suggest that the first thing that they would want to do is reach back out to that health plan. They could potentially initiate an appeal with the health plan to have them look into it a second time. Most times you can also ask for an external review. And in that case, someone outside of the health plan is going to decide whether or not the services are covered. And then if all of that is too much to remember, folks can always reach out to our consumer helpline, and we're glad to provide a lot of information about rights, consumer rights, and help folks figure out their options, including filing a complaint.
Right. And that helpline is open during weekday business hours, and we'll give you the number here at the end. But thinking about their insurance, what are some of the things that fall under mental health coverage care?
Yeah, well, mental health benefits include treatment for serious mental illnesses like major depressive and bipolar disorders, but also autism spectrum disorders and substance use disorders.
Okay. And Cindy, where can people go if they'd like to find out more information about mental health and their insurance?
Yeah, well, TDI works closely with the Texas Health and Human Services Commission with issues like mental health parity. HHSC has an ombudsman for behavioral health that you can call. And HHSC also has a website loaded with tons of great information, and that's mentalhealthtx.org.
Both great places to start. Thanks so much for helping us out today, Cindy. We've got a lot more information about health insurance on our website. It's tdi.texas.gov. And if you've got a specific question that you can't find an answer to, you can call that helpline we mentioned. Our helpline is 800-252-3439. So for Cindy Wright, I'm Ben Gonzalez, and this is TDI.